Hello, and thanks for checking out our video. The Senior Health Team presents Medicare 101 to provide an overview of Medicare and updates on the latest developments impacting this market. Medicare is a social insurance program established in 1965, created to help those people that are 65 and older, those who are disabled, or those who have permanent kidney failure. Currently, Medicare provides coverage to more than 59 million people. With nearly 10,000 baby boomers turning 65 every day in our country, this senior health market presents unprecedented sales opportunities. Medicare consists of 4 parts. There's your traditional Medicare that consists of Part A, your hospital insurance, and Part B is your medical insurance. Part C is commonly referred to as Medicare Advantage, and Part D is your prescription drug benefit. Medicare Part A is premium-free when the beneficiary or their spouse have 10 years or more of Medicare-covered employment. If receiving Social Security retirement income, automatically one is enrolled at age 65. People with less than 10 years of Medicare-covered employment can still get Part A, but will have to pay a premium. Under Medicare Part A, beneficiaries will pay a $1,364 Part A deductible. This deductible is for inpatient hospital care in a semi-private room that includes meals, general nursing, and hospital services. After 60 and 90 days, individuals will be responsible for a per-day expense of $341 and $682, respectively. Skilled nursing care incurs a per-day expense of $170.50 after the 20th day. Expenses for hospice care include $5 for outpatient prescription drugs and 5% of the Medicare improved amount for inpatient respite care. And with regards to blood transfusions, individuals are responsible for paying for the first 3 pints. Medicare Part B is your medical insurance portion of Medicare coverage. There is a $135.50 premium associated with Part B in 2019. And for higher income beneficiaries, they pay this $135.50 plus an additional amount based on the income-related monthly adjustment, which will be detailed on the following slide. Social Security tells beneficiaries the exact amount that they will pay for Part B each year. If one does not sign up for Part B when first eligible, or if they drop Part B and get it later, they have to pay the late enrollment penalty for as long as they have Medicare. The monthly Part B premium may go up 10% for each full 12-month period that one did not have other credible coverage and could have had Part B, but did not sign up for it. Here you will see a slide that demonstrates the amount that higher income earners will pay for their Part B premiums. Anyone earning $85,000 or more will pay a higher premium. The modified adjusted gross income from 2 years prior determines the amount that they pay in that current year. If the income is above a certain amount, they'll pay the standard premium amount and an income-related monthly adjustment amount, known as IRMA. And this extra charge is added to the Part B premium. Medicare Part B has an annual deductible of $185 in 2019 and a 20% coinsurance for most services after the deductible is satisfied. Part B covers doctor services and outpatient care, your traditional office visits, preventative services, diagnostic tests, some therapies, and durable medical equipment. Part C is commonly referred to as Medicare Advantage. It must cover at least what Medicare covers, and it's said that it replaces original Medicare, but one still has to pay their Part B premium. By replacing original Medicare, that means that when one visits their medical provider, that provider then submits the claims directly to the private Medicare Advantage insurance carrier, not to Medicare. Medicare Advantage plans cost zero to little premium per month in exchange for higher out-of-pocket costs. People can only enroll in Medicare Advantage plans or switch during certain times of the year, and they're network-based plans, HMO or PPO plans. Part D is the prescription drug portion of Medicare, offered by private insurance carriers, and they charge a premium. All the drugs for prescription drugs are classified into specific tiers and have corresponding copays. Part D plans are either standalone plans or can be combined with Medicare Advantage plans. And there's also a late enrollment penalty, which is calculated by multiplying 1% of the national base beneficiary premium times the number of full uncovered months that one didn't have Part D or credible coverage. The average monthly 2019 Medicare Part D base premium used to calculate this penalty actually decreased to $33.19 from the 2000 amount of $35.02. This premium then is rounded to the nearest tenth and added to one's monthly Part D premium with whichever carrier they have their coverage with. When someone turns 65 or is preparing for their retirement and they need to go on Medicare, they often ask, well, when do I enroll? How do I enroll? And this is a very important information to be able to share with those people in this situation. For many who are not receiving Social Security benefits when they turn 65 and therefore not automatically enrolled into Medicare Parts A and B, they can enroll during their initial election period, which is 3 months before the month of their 65th birthday, the month of their 65th birthday, and up to 3 months after. This initial election period also pertains to Medicare Advantage plans and Part D prescription drug coverage. If a Medicare beneficiary does have credible coverage at age 65, they can decline Medicare Part B enrollment and enroll then when losing that credible coverage. They can enroll once their employment or coverage based on their employment ends, whichever occurs first. In this situation, they have 8 months to sign up for Part B without a penalty. And it's very important that those in this situation understand that this 8-month period runs whether or not one chooses COBRA. So if one does elect COBRA coverage, it's important that they know that they must not wait until the COBRA coverage ends to enroll in Part B. If one does not apply for Medicare Part B when first eligible or qualify for a special enrollment opportunity, they can only enroll then during the general enrollment period, which is January 1st through March 31st of each year, with coverage then effective not until July 1st. Many in the industry are very familiar with the annual election period that occurs each fall, October 15th through December 7th. This period allows Medicare beneficiaries to enroll in any Medicare Advantage or prescription drug plan. Those in an MA plan can also disenroll and return to original Medicare and apply for a Medicare supplement. It's important to note that enrollment in a MedSup is not guaranteed during this annual election period. And brand new this year is the Medicare Advantage open enrollment period that runs January 1st through March 31st. That allows individuals enrolled in an MA plan to elect a one-time switch to another MA plan, with or without Part D coverage, or to return to original Medicare. Those using this OEP to make a change may make a coordinating change to also add or drop Part D coverage. It's important to note that enrolling in a Medicare supplement plan during this time is also not guaranteed. Those who enroll in a Medicare Advantage plan, though, during their initial election period are also afforded an opportunity for an open enrollment within the first 3 months that they have Medicare. When one turns 65, they can either choose to then supplement their original Medicare coverage with a Medicare Advantage or a Medicare supplement plan. You can either have one or the other. A Medicare supplement plan covers the gaps in Medicare, the deductibles, coinsurance, and copays that were detailed earlier on in this presentation. As you can recall, those were some very significant out-of-pocket costs to original Medicare that people would have to incur. Those amounts do change each year, but it's important to note that Medicare supplement plans cover these new amounts. But Medicare covers less than half of the beneficiary's total costs, therefore making Medicare supplements a critical need for those in the senior health market. In 2013, CMS estimated that Medicare beneficiaries spent $5,503 out of their own pockets for their health care expenses, an average of 41% of their per capita Social Security income. Medicare supplement plans are guaranteed renewable, meaning that as long as one pays their premium, the carrier is mandated to keep their policy in force. Medicare supplement plans, people can see any provider that accepts Medicare, and no referrals are needed. This chart shows an outline of coverage of the current Medicare Advantage plans available. Medicare supplement plans are standardized plans, which means the benefits are the same regardless of the carrier. Currently, Plan F and Plan G are the two most commonly sold plans, but that's going to change when Medicare's macro regulations take effect in 2020, which I will discuss later on in this presentation. Plan F pays all the coinsurances and deductibles. As long as it is a Medicare-approved charge, the Plan F policyholder will not have to pay any out-of-pocket costs. And Plan G pays all the benefits as Plan F, except for the $185 Part B deductible. Often the difference in annual premium can be more than $185, so the Plan G can provide significant savings versus Plan F, and rate increases can be less. Lastly, it's important to note that those enrolling in Plan N is rapidly increasing and presents another strong opportunity to save your clients on their healthcare costs. With Medicare supplement plans, most plans cover their basic benefits. Basic benefits include the Part A coinsurance for inpatient hospital care, the cost of 365 extra days of inpatient hospital care, the Part A hospice coinsurance, the Part B 20% coinsurance after the deductible has been met, and Medicare supplement plans will pay for the first 3 pints of blood each year. Some may often wonder, how are the premiums determined for a particular Medicare supplement plan? Why are some premiums different amongst different carriers? Why can they be higher in some areas than in others? Well, Medicare supplement premiums are based upon gender ratings of male or female, tobacco or non-tobacco usage, and a critical factor is the area in which one resides. We're usually broken down by specific zip codes. Carriers can also get creative by offering a discount, a household or a spousal discount, which many carriers do offer. And premiums are adjusted according to risk. Part of Medicare supplement plans are annual rate adjustments that help keep pace with rising Medicare claim trends and changes in annual deductibles and copays. Now, enrollment into a Medicare supplement plan is often dependent upon the Medicare Part B Effective date. The open enrollment for a Medicare supplement plan is a 6-month period that starts on the first day of the month in which the person is enrolled in Medicare Part B and at least age 65. During this period, an insurance company cannot deny a person any Medicare supplement policy it sells, make a person wait for coverage to start, or charge a person more because of their health problems. It's just important to remember that this open enrollment period, again, is dependent upon the Medicare Part B date and not the age usually affiliated as being 65. If one has passed his or her open enrollment period, where they've been enrolled in Medicare Part B for more than 6 months, they may still have an opportunity to receive Medicare supplement coverage if they qualify for a guaranteed issue scenario. An involuntary loss of credible coverage that was primary to Medicare is the most common guaranteed issue situation that we see. In this situation, if one is losing primary credible group coverage, they have an opportunity for 63 days from the day they lost coverage to apply for a Medicare supplement plan A, B, C, F, K, or L. Plan G or Plan N is not available in a guaranteed issue situation. Other guaranteed issue scenarios are specific to losing Medicare Advantage coverage. And if you have a specific question regarding those scenarios, please be sure to let us know. Also, with regards to guaranteed issue, the insurance carriers can often pay a lower commission for this business. When one is outside their open enrollment period or they don't have a guaranteed issue situation applicable to them, they can still apply for a Medicare supplement plan, but will go through a medical underwriting process. Underwriting can be applied and based upon answering of the health questions on the application, height and weight of the individual, the medications that one takes, and can be subject to pre-existing conditions with some carriers and in some states. Now, for those who are under 65, they may wonder, can they get Medicare? Can they have a Medicare supplement? If one is receiving Social Security disability payments for 24 months, then they are automatically enrolled in Medicare Part A and Part B. However, since Medicare supplements are not required by federal law to those under 65, it's only available in certain select states. Some state laws are different and require carriers to offer plans to those under 65. However, if a person has Part B when they reach age 65, they will be granted a new 6-month open enrollment period upon turning 65. One of the new developments that's going on in our industry right now is the new MACRA law that will take effect in 2020. MACRA is the Medicare Access and Chip Reauthorization Act of 2015. It was made law in 2015, and many of the regulations will be implemented and effective January 1st, 2020, when Medicare supplement plans like Plan C and Plan F will no longer pay the Part B deductible. You may have heard reference to Plan F going away in 2020, in fact. However, this is not the case. Medicare supplement plans, while no longer will be able to pay that Part B deductible, Plan C and F can still be sold after January 1st, 2020, but only to Medicare beneficiaries who were eligible for Medicare prior to that date, regardless of what plan they had previously. Those newly eligible for Medicare after January 1st, 2020 will not be able to purchase Medicare supplement plans C and Plan F. We will be sure to let you know of all these latest developments regarding these changes. That concludes our presentation, and I just want to let you all know that you are able to rely on Art Jetter and Company For all your insurance marketing needs for life, health, group benefits, disability, critical illness, annuities, long-term care, and short-term care. And agents who appoint with us with any of our senior health carriers have complimentary access to our quote tool and free customized leads program. If you ever have any questions or regarding the senior health market, please be sure to reach out to us at 800-228-0008 or email us at seniorhealth@jetter.com.